Can an aura help differentiate seizure types in epilepsy? Imagine feeling a strange sensation or a sudden change in your perception right before a seizure. That experience is called an aura, and it can be a valuable clue in understanding epilepsy. An aura is a subjective feeling or perception that occurs just before a seizure starts. It can involve sensory changes like seeing flashing lights, hearing sounds, or feeling numbness. Sometimes it involves emotions or thoughts that seem out of place. Importantly, an aura is usually part of a focal seizure, which begins in one specific area of the brain. Focal seizures are divided into those where the person remains aware and those where awareness is impaired. Auras are more common in focal seizures, especially in those where the person stays conscious. In contrast, generalized seizures involve both sides of the brain from the start and typically do not have an aura. This difference is key because if someone experiences an aura, it suggests the seizure begins in a specific brain region, often in the temporal lobe. For example, an abdominal aura, which feels like a rising sensation or discomfort in the stomach, is strongly associated with temporal lobe epilepsy. Recognizing these patterns helps doctors determine where in the brain the seizure originates. Auras can also help differentiate between types of focal seizures. For instance, sensory auras, such as tingling or visual disturbances, often point to seizures starting in the occipital or parietal lobes. Psychic auras, like déjà vu or strange feelings, are linked to temporal lobe seizures. Knowing the type of aura can guide clinicians in localizing the seizure focus, which is crucial for treatment planning. If a person reports a specific aura repeatedly, it can help doctors decide whether medication, therapy, or even surgery might be appropriate. For patients, understanding their auras can be empowering. If they learn to recognize early warning signs, they can take precautions to stay safe, like moving to a safe place or alerting someone nearby. This awareness can reduce injury risk and give a sense of control over their condition. It also helps in tracking the pattern of seizures over time, which can be useful for medical consultations. In summary, auras are more than just strange feelings. They are important clues that can help differentiate between seizure types. They often indicate that a seizure starts in a specific part of the brain, especially in focal seizures. Recognizing and understanding these sensations can assist both patients and healthcare providers in localizing seizures, tailoring treatments, and improving safety. However, because individual experiences vary, it is always essential for anyone with epilepsy to work closely with their healthcare team to interpret their symptoms accurately. If you or someone you know experiences unusual sensations before a seizure, discussing this with a medical professional can provide valuable insights and help in managing the condition effectively.